Have you ever wondered why it's so crucial to evaluate a patient's airway before administering anesthesia? Well, let's delve into this fascinating topic and unravel the significance of airway evaluation. It's much more than just a tick on your preoperative checklist. It's an essential step to ensure patient safety and favorable outcomes. Imagine the airway as a pivotal highway for the breath of life. Any obstruction or difficulty in this path can lead to serious, sometimes life-threatening complications. The primary purpose of airway evaluation is to anticipate and plan for potential challenges in ventilation and intubation. Ventilation is the process of delivering oxygen to the lungs and removing carbon dioxide, while intubation involves placing a tube into the windpipe to maintain an open airway. If either of these processes are impeded due to an unexpected airway issue, it can escalate into a critical situation rapidly. Now, consider the risk of aspiration. This is when stomach contents reflux into the throat and can potentially enter the lungs. Anesthesia can relax the body's reflexes, making aspiration a real threat. But guess what? A thorough airway evaluation can help us predict and prevent this risk. Airway evaluation is like a crystal ball, giving us insights into the patient's unique anatomy and potential challenges. It allows us to tailor our approach, choose the most suitable equipment, and be prepared with a plan B and even a plan C. Improving patient safety is the cornerstone of healthcare. By evaluating the airway, we can significantly reduce the risk of complications and improve the patient's experience during and after the procedure. In essence, airway evaluation is not just about looking into the mouth. It's about understanding the patient's unique anatomy, predicting potential challenges, and planning for the safest, most efficient care possible. So it is evident that airway evaluation is not just a routine procedure, it is a lifesaver. Now that we understand its importance, let's dissect the process of airway evaluation. Airway evaluation is a multifaceted process that begins with a comprehensive review of the patient's medical history. This is a crucial step, as it can provide valuable insights into any pre-existing conditions or factors that may impact the patient's airway. This could include a history of snoring, sleep apnea, or previous difficulties with anesthesia. Following the medical history review, we then proceed to a thorough physical examination. This isn't your typical checkup. We're looking closely at the patient's general appearance, body habitus, facial features, and neck mobility. Each of these aspects can provide clues about the ease or difficulty of airway access. The patient's general appearance can give us an idea of their overall health status. For instance, obesity can suggest a potentially challenging airway due to excess tissue in the neck and throat. Body habitus, or the physical and constitutional characteristics of an individual, can also provide important information. A patient with a short, thick neck or a large tongue may present challenges when it comes to airway management. Facial features aren't just about aesthetics in this context. We examine the patient's jaw structure, cheekbones, and other facial features to assess the amount of space available for airway devices. For example, a prominent overbite or small jaw could mean limited space for airway management. Neck mobility is another crucial consideration. If a patient's neck is stiff or has limited range of motion, this could pose difficulties in positioning the patient for optimal airway access. As you can see, each step of the process is designed to gather as much information as possible. By understanding the patient's unique characteristics and potential challenges, we can create a tailored approach to airway management that maximizes safety and effectiveness. Remember, the first step in airway evaluation is always to gather as much information as possible about the patient. Next, we delve into the world of the Mallampati score. An ingenious grading system, the Mallampati score is an essential tool for medical practitioners and anesthesia providers worldwide. It gives us a way to predict the ease or difficulty of intubation, a crucial procedure performed before anesthesia. But what exactly is the Mallampati score, you ask? Well, it's a score that's determined by visualizing the oropharynx, which is the middle part of the throat. You see, when we open our mouths and say, "ah," we're essentially giving a peek into our oropharynx. Now imagine being able to predict how easy it would be to pass a tube down that throat, just by looking at the structures visible. The Mallampati score works by grading the visibility of certain structures in the oropharynx. These structures include the soft palate, uvula, fosses, and pillars. The more of these structures you can see, the easier it should be to intubate. Conversely, if you can't see many of these structures, it might be a sign that intubation could be challenging. To assign a Mallampati score, the patient sits upright, opens their mouth wide and sticks out their tongue as far as they can. The practitioner then assigns a score from 1 to 4, with 1 being the easiest and 4 being the most difficult. A score of 1 means all 4 structures are easily visible. A score of 2 means the uvula is partially obscured. A score of 3 means only the soft palate and base of the uvula are visible. And a score of 4, that's when none of these structures are visible, indicating a potentially difficult intubation. It's important to note though that while the Malampati score is a useful tool, it's not foolproof. It's just one piece of the puzzle in the complex process of airway evaluation. The Malampati score, thus, provides us with a quick and easy way to assess the potential difficulties in intubation. Beyond the Malampati score, there are more tests to aid in airway evaluation. Let's delve into these additional tests, which provide further layers of information about the patient's airway and can help us anticipate potential challenges in intubation or ventilation. Firstly, we have the thyromental distance. This is the measurement from the thyroid notch to the lower border of the mandible, or in simpler terms, the distance from the neck to the jaw. It's a straight line distance that can give us an idea of how much space we have to maneuver during intubation. A normal thyromental distance is about 6 to 7 centimeters. If it's less than 6 centimeters, it may indicate a difficult intubation. Next, we have the sternomental distance. This is the measurement from the sternal notch to the mentum, or the chin's bottom point. This distance should be approximately 12 to 14 centimeters. If it's less than 12 centimeters, it could suggest a potential difficulty during intubation. This measurement gives an indication of the neck's flexibility and extension, which can be crucial during the intubation process. Both of these tests are quick and easy to perform, and they can provide valuable insights into the patient's airway. They can help us understand if the patient has an unusually small or large mouth, a short neck, or limited neck mobility, all of which could present challenges during intubation. Remember, these tests are not foolproof. They are not meant to replace clinical judgment or experience, but rather to supplement it. They are additional tools in our arsenal, helping us gather as much information as possible to make an informed decision and plan the best course of action for our patient. These tests, while simple, are vital tools in our airway evaluation kit. They allow us to be better prepared and more confident as we approach the task of intubation or ventilation, ensuring the best possible outcomes for our patients. While these tests are important, nothing beats experience and clinical judgment. That, my friends, is the cornerstone of medical practice, and it holds true even in the world of anesthesia and airway assessment. Let's delve deeper into this. You see, the human body is a marvelously intricate and complex machine. No two bodies are exactly the same, and hence, no two airways are exactly alike. Our tests and scores, like the Malampati score, can provide us with valuable information. They help us predict potential challenges, prepare for them, and decrease the risk of complications. But they are not foolproof. They are not an absolute measure of what we will encounter when we actually administer anesthesia. This is where experience and clinical judgment come into play. They are the key elements that allow us to interpret the results of these tests in the light of the unique characteristics of each patient. They help us to discern the nuances that can't be captured by a simple score or a test. Consider an experienced anesthesiologist. Over the years, they have evaluated hundreds, if not thousands, of airways. They have seen a wide variety of mouth shapes, throat sizes, and tongue positions. They have faced unexpected situations and learned from them. This wealth of experience allows them to recognize patterns, anticipate potential problems, and make decisions that are tailored to each patient's unique situation. Clinical judgment, on the other hand, is the ability to make sound decisions based on clinical information. It involves critical thinking, problem-solving, and decision-making skills. It's about looking beyond the test results, considering the overall clinical picture, and making the best decision for the patient. So, while we rely on these tests, we must also trust our clinical judgment. We need to remember that the tests are tools, but we are the craftsmen. We need to use these tools wisely, but also rely on our experience and judgment to make the best decisions for our patients. After all, that's what being a medical professional is all about. Let's now summarize the key points to remember in airway evaluation. First and foremost, the significance of airway evaluation can't be stressed enough. It's a vital step in ensuring the safety of our patients before administering anesthesia. It helps us predict any potential difficulties that might arise during intubation, and this knowledge allows us to prepare and react accordingly. Now moving on to the process of airway evaluation. It's not just a one-step procedure, but a comprehensive assessment, including a detailed patient history, physical examination, and specific tests. Remember, any information, no matter how minute, might be the key to predicting a difficult airway. We then have the Mallampati score, a simple yet effective tool to assess the airway. It's based on the visibility of structures within the mouth, and gives us a rough idea of how easy or difficult intubation might be. However, the Mallampati score isn't the be-all and end-all of airway evaluation. It's merely one piece of the puzzle. In addition to the Mallampati score, there are several other tests that can be performed, such as the thyromental distance and sternomental distance measurements. These tests can provide additional insights into the patient's airway and further aid in our prediction of a difficult intubation. Lastly, let's not forget the role of experience and clinical judgment. While all these tools and tests are extremely helpful, they are not infallible. It's the clinician's years of experience and keen clinical judgment that can make the difference when these tests fail to predict a difficult airway. So, as we wrap up this segment, let's keep in mind the importance of a well-rounded approach to airway evaluation. It's not just about ticking boxes, but about gathering as much information as possible to ensure the safety of our patients. Remember, a thorough and accurate airway evaluation is the cornerstone of safe anesthesia. As we wrap up, it's clear that airway evaluation is a critical step in administering anesthesia. This process, from understanding why we evaluate the airway, through to the actual evaluation, and the Mallampati score, is all part of ensuring the safety of our patients. We've looked at additional tests, and the vital role of experience and clinical judgment in making accurate assessments. The key points to remember are the importance of a thorough and systematic approach, the need to consider multiple factors, and the value of ongoing practice to perfect these skills. This is not a routine to rush through, but a crucial element in ensuring our patients can breathe easily during their procedures. So, let's all strive to enhance our skills in airway evaluation, because it's not just about checking a box. It's about safeguarding our patients' lives. And with that, we conclude our discussion on airway evaluation. Remember, every breath counts, so make each one safe by starting with a thorough airway evaluation.